watching TVC Breakfast. Now, the world is commemorating World Health Day, but it is facing one of the worst pandemics it has ever seen. It is a race against time to slow the spread of the coronavirus, and nations of the world are scrambling for a vaccine and a possible cure. What about social distancing and how it can help flatten the curve? This is one of the big questions that Nigerians are asking and the world citizens are asking across the globe. Joining me now to discuss this is my colleague, TVC News Health Correspondent, Jacquiline Ogor. Jacquiline, it's a busy time for you. You are here, you are there, you are here, every time and everyone asking. In fact, I see that you're becoming almost an authority now when it comes to what is the latest in the COVID-19. But it's good to have you in the studio this morning. Now, before I let you run away to some of your duties, the issue around vaccine. It's a topic across the globe. It's a topic in Nigeria. A lot of Nigerians are asking, how easy or how difficult is it to get vaccines for? So it puts a pressure on the system, puts a pressure even on government to get vaccines for COVID-19 or for anything at all for that matter. Talk to us about what you're hearing from people.
Yes, you know, Nigerians like to have it the microwave way, but when it comes to the development of drugs and vaccines, you can't have it that fast. And that's why when researchers come up to say, you know, we need money to develop, you know, drugs or vaccines, especially research, to do their research, you know, they should be taken seriously because you don't really know when that emergency will crop up, and then you need what they know and what they can do to save lives. Now, it goes like this, you know, for vaccines and drugs. You have your own genotype, I have mine. You have your blood type, I have mine. So what they do is that they developed drugs to see if a wide range of persons can use these drugs and also vaccines, and then they won't have adverse effects.
Checking how compatible
this
vaccine is to
with a human system and a wide range of people. Now, when you want to manufacture a product, you want to make sure that many people can use your product. So when you go out there working on it, you want to see how much you can achieve on a wider range. So that's what they do, and it takes time. Sometimes when they're developing drugs and vaccines, they don't just go to the human structure. They deal with animals, they deal with all kinds.
So it's going to take a long while before we see anything called vaccine or cure for COVID-19 or
by miracle, you know, sometimes you don't rule out chances. Well, let me say this fact. People will have to be careful the way they put this pressure, because if the experts, the researchers, they make any mistake, that means that we're talking about deaths again.
You can cause lives.
So that's why you see that sometimes they have this calm attitude because, you know, you don't understand, but they understand. And there is the need for government to take them seriously. You know, in developed nations, a lot of the money, you know, earmarked for the health sector, they make sure that researchers get their chunk because they have to do both local and international collaborations to come out with good findings, to come up with, you know, drugs and vaccines that can work and be compatible with a wide range of people.
All right. Jacqueline, we have to leave you here now. There's no time. I know you're itching to run away to the field right now, but thank you so much for your time.
Thank you for having me.
Thanks for being there. Thank you. Right.